So a lot of evidence is out there for using parasympathetic activation. So we have two different autonomic states. We have our sympathetic nervous system, which is essentially fight or flight, and we have our parasympathetic system, which is essentially our rest and digest. And one of the most effective ways of activating our parasympathetic, our rest and digest pathways, is by activating our vagus nerve. And there are many ways that we can deploy to activate our vagus nerve. In fact, there's a lot of really exciting evidence to say coming out that using electrical devices underneath the tongue actually really helps patients with Parkinson's disease, because that again is activating our vagus nerve. We don't need to do that, though. We can actually do that in much more simple ways. So one of the ways that we can use to activate our vagus nerve is by activating our voice box, our larynx, and we can do that by gargling or gagging. Now, by gargling is a little less effective, gagging is much more effective. But basically what you want to do is either gargle or gag until your eyes water. Now the eyes watering is actually quite important, because eyes watering is triggered by the facial nerve, cranial nerve 7, a vagus nerve is cranial nerve 10. And so what we want to do is overload the vagus nerve with information in order to get that parasympathetic rest and digest response. And by gargling or gagging until your eyes water, you've overloaded the vagus nerve, and then it talks a little bit, get this cross-talk into its friend, cranial nerve 7, and so your eyes start to water. So the most effective, gargling or gagging until your eyes water. But if you're feeling really, really brave, probably the most effective way of getting that beautiful parasympathetic rest and digest activation is actually having a coffee enema. And the reason for that is we have nicotinic receptors in our lower part of our colon, which actually is very strongly activated by coffee. And so if you have a coffee enema, you're going to really feel the need to expel the coffee. And by doing that, if you can hold it in, you're going to get a really beautiful vagal nerve activity. Obviously, that's not for everyone, so most patients just stick with, and indeed I only stick with, using the gargling or gagging till the eyes water.